I think PGB is a good system. It really helps people in arranging their life in the way they want to arrange their life. So I think there's a good future for PGB. It opens up part of the labor market which would otherwise not be available to care. Because people with a PGB, they contract their neighbors, relatives, people they know in the street, people they know from church communities and things like that. And those people are very much willing to work for a budget holder, but would not be willing to work for a big organization in healthcare.
The difference that the personal budget made in the care of my son is that I guess I got access to a different kind of providers. Somebody who will not just spend time sitting beside him on the sofa watching television, but really working with him and helping us all together to help him get further in life.
PGB has been a success. It's been very popular among patients, very popular, hugely popular. So that's an indicator of success, I guess. It also has led to much innovation, to much more new small enterprises entering the market. So I think that's, you can say that's a success also. And finally, it has filled all kind of gaps which were not covered or are not covered by the normal professional healthcare system.
What is important to stress is that this government wants to encourage the personal budget, and that's a good thing. They put 350 million extra euros in the personal budget system, so now there is 2.7 billion euros for the personal budget. That means that around 125,000 people are using now in the Netherlands the personal budget. But in this time of economic problems, you see also the cuttings in the budget. And that's a very bad thing for the individuals, because they are getting to lose 5% of their budget. And 5% less means 5% less possibilities to buy good help. And that means that partners, family, children have to take more time, to spend more time to help people with a long-term disability.
The general limitation of the budgets, as well as the limit that has now been imposed to the fees, hourly fees we can pay, of course mean that I had to talk with my provider and see if she was prepared to work for less money, basically. And yes, we have less money, less hours of help. It's not that it has completely taken it away, but yes, we have to do with less.
I see a very good future for the personal budget system, that because it takes as a starting point that people with a personal disability has the power to arrange their own lives. We started 15 years ago with 0 budget holders. Now there are 125,000 budget holders. Every year, the amount of people is increasing with 10%. It means that this is a part of society, and people with a long-term disability belong in society. So 1 and 1 is 2, the budget has the future.
Basically, the PGB system is a good system. The problem now is that more and more people are using it, and therefore it's becoming more and more expensive. And also in the Netherlands we have to cut on budgets. So the big challenge for this moment is how to cut on the costs, but keeping the system as good as it is at the moment. That's the challenge.